Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thanks for tuning in today to the Tate Chronicles. Join me and my guest as we cut through the fog that exists at the leading edge of healthcare technology and delivery. I'm really pleased today. My guest is Eric Rock, who is the founder and CEO of Vivify Health. Vivify Health works on the front line of connected care management and patient engagement. Their goal is to keep patients healthy at home and reduce hospital admissions and emergency room visits. Eric, welcome to the show today.
Jim, thank you for inviting me. I'm really anxious to connect with you and discuss the future of healthcare and how it may be delivered remotely.
Absolutely. Well, there's a wealth of documented evidence already of the value of remote patient monitoring in terms of better outcomes, better management, not to mention the obvious cost savings involved. The combination of the hardware, the software, and the intelligent processes that are in place are evolving very, very quickly. So let's just jump into some of these things, Eric. First, can you provide an overview of Vivify's platform for remote patient monitoring?
Well, certainly, Jim. Vivify's platform goes well beyond remote patient monitoring, although that's where it began, serving the large health systems across the U.S. and then emerging and growing into all types of customers, including large payers. The platform as a whole is intended to help deliver care from a distance, to deliver care remotely, most importantly, to deliver care in the home setting where the outcomes have been measured and proven to be better than that of a hospital, where you can avoid things like infections and the types of things that can occur in that acute setting. So with the platform, we apply consumer electronics such as tablets and smartphones, paired up with complex sometimes and simple biometric devices, paired all of that with content that wraps that is guiding and coaching the patient in a way to get the best possible outcomes, but also collecting more information than we get from biometrics alone, customized for their specific needs and conditions, and presented back to the clinicians that are providing that care remotely. And that's a key part to this platform. It is not tech alone. It certainly leverages technology to assure that providers and nurses can efficiently deliver care at very large scale and low cost with fantastic outcomes to these patients in their home. So there's a back-end clinical component that connects into existing clinical workflows, including virtual visits, but also gathers that data so that now instead of a medical record that pivots around an episodic encounter such as a hospital, a new medical record is being created here that's longitudinal, considering every day of their life, and that information for that 95% of the time that's needed for delivering care, which could be every day. So Vivify is that digital health platform that is broadly connected end-to-end, engaging clinicians to deliver the best care they possibly can.
You know, Eric, I can remember, I guess maybe a decade or so ago, when maybe a lot of this started, when hospitals would discharge patients with specific diagnoses that brought them into the hospital and try and prevent readmission. Initially, it was as simple as they would send a patient home if they had congestive heart failure with a scale, and they'd call that patient every day or every other day and have them get on the scale, see if they gained 1 or 2 pounds that day or 3 pounds over 2 days, something like that, to see if they were retaining fluids. That was the first wedge into this whole thing, but it's gotten much more involved, certainly over the last 10 years and certainly over the last 2 or 3 years as things have evolved. So first, let's just talk about some of the chronic conditions that really lend themselves well to this remote patient monitoring approach. What do you think some of the conditions are? Yeah.
Yes, certainly. You know, there's the obvious CHF, COPD, diabetes. Certainly many others are rising, including hypertension. And we actually incorporate over 100 different clinical pathways that we have validated over time across our large health system and payer customers. In fact, 10 years in development with these pathways, as we call them, that can be merged together to cover, of course, the comorbid and any new pathway created when we have new customers that have a unique clinical goal or program. We can build those together with these customers, and we continue to add to those pathways, while at the same time we also continue to add intelligence to them in a way that can be more prescriptive and customized at the individual patient level, but also as we progress with things like AI to bring more intelligence to create an efficiency in how we manage that population, where we can duplicate, in some cases, some of the things that are done on a recurring basis by a provider. But to get more specific, the conditions are growing, and the content is unlimited in how we can continue to add to and revise for constantly emerging use cases for this platform.
One thing that's changed over the last, I don't know, maybe 5 or more years, Eric, has been the payers, groups like the large Athenas or Blue Cross Blue Shield, as they have become more involved in patient care themselves. And so who are your customers? Are they payers? Are they hospitals? Are they large practices? Who are your customers?
Well, let me reflect back on your last question. You referred to, the hospital and discharging for CHF with the weight scale. That's where it all began. Vivify was launched in 2009, and there were, existing technologies, often a bit clumsy in their approach. We helped to automate that using consumer electronics and just like, if you call it Uberizing of digital care, we certainly have accomplished that. But my last company was MedHost. MedHost was the leading EMR for emergency departments. So it's very familiar with the revolving door of those patients coming in and out of a hospital and the costs associated with it, which led to, shortly after the iPhone came out, our vision to apply technologies like that for these health systems. So to answer your question, our first customers, because of our experience with 15 years prior, was to approach those large health systems with a new tool that they could deliver better care remotely and reduce those readmissions was the initial focus. In the early days, they had the penalty for those that had over 20% of readmissions. And so that was the first, if you will, opportunity for an ROI to chase that as value-based care was emerging and reimbursements were also improving from our government. So we certainly did focus on hospitals first. However, we grew over time to anybody that was responsible for value-based care or whole risk with the population. Those are often ACOs. Home health was starting to take a role in this as well because they were in the home and touching these patients. And so they would participate in value-based or risk-based models. And then ultimately the payers jumped into this in the past 3 to 5 years especially. And so all of those are our customers. The majority of our customers today are those large health systems, those IDNs, and some smaller provider organizations. But we're rapidly now sharing this technology between payers and providers as new value-based relationships are forming. So it's a broad set of customers that are all responsible in delivering care.
Well, Eric, let me give you a scenario, and you could tell me how this could be teased out in the real world. Let's say I'm a large multi-specialty practice with 30 or 40,000 patients, and maybe a couple hundred of those, or maybe a couple thousand of those, have the chronic conditions. They need to be monitored: diabetes, hypertension, CHF, COPD, and so. And they want to set up a program, and that program involves obviously different types of devices in these people's residences. Can be simple, sometimes a little more complex, with a data feed that comes back, I'm guessing, here to some type of dashboard that is maybe that triages risk scores and maybe alerts somebody that some intervention needs to take place. Am I on the right track here, how that would all work?
You are, but there's another critical component here. It is more about the people and process than it is the technology, because this is something entirely new for most provider organizations to take responsibility for and improve health outside of their four walls. And so to assure that they are operationally ready, Vivify has that over a decade of experience and the largest footprint where we bring that operational excellence to the table and help them define what would a good program look like. And we do this with clinical consultants and other experts, analysts that come in as part of our overall offering. We don't charge extra for that, by the way. That's part of our individual software fee. And those services help them understand what resources do they need. We discuss what are their business goals, and most importantly, we discuss what population are they targeting and to what outcome goal as well that's often tied to the business goals. We put all of that together and assure that they have the right clinical resources, operational readiness, and then we apply the technology secondarily where it's needed. We don't want to apply tech for tech's sake. We don't want to make it too expensive. We want to reduce the tech, in fact, as much as we can, so that this care management team can be as efficient as possible at the lowest cost. ROI is critical. Everybody has to run the business. We have to focus on the patients first and their outcomes. But if these companies, these organizations can't stay in business, they can't deliver care. So we have to make it efficient. We help them accomplish those goals by looking at the business goals first and then applying the technology. And the technology is applied exactly like you just said. We look at which populations we need to deliver, for example, a simple kit for a senior population that doesn't know how to use a smartphone. Or perhaps they have a smartphone or tablet and we can use what we call BYOD or Pathways Go that enables the use of their existing hardware, which lowers the costs. So there's various approaches. And then the clinical back end, that's all part of that program that I discussed with the clinical consultation to make sure that they're operationally ready.
Well, and so kind of that clinical back end you're talking about, once a system is implemented and is up and running and I guess for lack of a better word, monitoring various conditions depending on the patient and their situation. These, whether they're real-time feeds or episodic feeds of data coming from those patient devices, is our alerts set up that can be on a dashboard that the provider sees, or text messages, or how does that work so they know when to do an intervention?
Oh, without question. If the goal is to assure that that patient is getting the best care and we're lowering the cost, meaning not going into a hospital preferably or even the doctor's office, you need to have some awareness of what's going on with that patient's health. And so there are clearly indicators of things that are outside of boundaries that are set on basic things like biometrics, but also on the numerous questions that are requested of the patient, combined with digital educational materials. With their responses, that subjective responses to their clinical pathways, in addition to the biometrics, the providers, the nurses have everything they need to truly see and sense what's going on with that patient to intervene as appropriate. That intervention is most often a virtual visit built right into the platform, very simple, single click to get there, and for all ages. Very successful, over 90% compliance with the elderly population. In fact, our tablet-based product has an average age of 77 years across all of our customers, and many north of 100. And so very simple to apply and accomplish a virtual visit, thus an intervention when appropriate from that data that is coming back to that portal. Plus that portal automatically prioritizes things based upon those that need the attention first. So you can have nurses and others that are working down that priority list to help them manage efficiently instead of round robin dialing everybody. That old telephonic approach is so outdated and so inefficient. This enables that care management team to manage efficiently for those that need it the most, including for some patients that simply just wanted the call back just to have that conversation. That certainly is a consideration as well.
You know, you mentioned the a virtual visit, and I guess you're talking about a televideo encounter.
That is correct.
And, there's been, I guess, a belief that that was going to be too high tech for people, or for certainly older population. And then we just had the pandemic, which for months and months was the only way to communicate with your provider. And then if you wanted to talk to your grandchildren on their birthday, you learned how to use Zoom pretty quick. And so there was a big jump there in technology acceptance, certainly in video and audio. So what we thought was going to be challenging was kind of to deal with those challenges was kind of forced upon the entire population. Everybody got up to speed pretty quickly, including the providers who maybe weren't doing many of those virtual encounters. So we jumped over that pretty quickly. One thing, let's talk a little bit, Eric, about reimbursement, because if a patient is having difficulty or they're a little bit short of breath or whatever, typically they'd be told to come into the practice, and that would be a billable encounter. And so now if they are being monitored at home, that could be taken care of. Has reimbursement for that kind of care kept up? I know that Medicare a few years ago did this a billing code for chronic care management, $40 or $50 a month, really for things that the practice was already doing anyway. For ongoing, where are we with reimbursement, and where do we need to go?
That's been the never-ending journey, of course, of technologies applied outside of provider organizations and settings. The traditional fee-for-service now has to be measured differently. And just as you described, chronic care management, the initial CCM reimbursement was very much measured on a time basis. How much time are you on that phone call or on that visit with that patient at home? And so that had very specific limitations, and it was rather stringent. It was hard to collect the data. It was hard to ultimately get the bill paid for that. So you saw lots of companies and attempts to be successful with CCM. The majority had failed. I think our government recognized that and made some improvements, certainly with the half dozen and more reimbursements that exist today, from RPM to telemedicine and in between. We are now seeing more thoughtful consideration for the deployment of technology, the coverage of the costs of some of that technology, and then assurances that data is actually driving that decision making. So RPM reimbursement being inclusive of connected biometric data, not patient self-entered, but actually connected devices. That's a thoughtful improvement to assure that the right technology is being applied to help measure the needs of these patients. So we are seeing absolutely fantastic trends now towards the appropriate types of reimbursement. We expect many more to come, and just as importantly, we expect the payers to jump in these relationships as well, because they are fast forwarding and following our government and setting up unique relationships and contracts, because those payers have that whole risk, all of that cost. And with these providers now showing interest to participate, the payers are saying, let's go, let's get this together, let's set up a value-based arrangement here. So beyond our government reimbursement, we are absolutely seeing the payers jumping on the bandwagon to help these providers cover those costs and see an ultimate ROI in their services.
Well, Eric, I imagine beyond the domain of care around long-term conditions like CHF and COPD and diabetes and hypertension, there are shorter-term conditions like patients in rehab after surgery or home health, things like that. And so do you see this as a service line of care outside of those long-term chronic conditions?
Without question, the flexibility of the platform, as I described earlier, with the pathways and the content and then the logic and rules that can be applied to each of these to create virtually any type of program that may be desired by the provider is easily accomplished. In fact, those that you mentioned, from home health hospice, oncology, you name it. We have very successful large-scale programs already with our customers in all of those. With rehab as an example, the pathways are somewhat unique because there's milestone-based goals, and there's a time where they're back in the hospital as an example. Well, there's pre-surgical, let's just go further with that, and then post-surgical. And so there are things that could interrupt the normal flow, that the pathways and content need to be intelligent so it doesn't get off track. And that's another unique example of what the Vivify platform can offer with some of those more episodic type of programs, including surgery, rehab, and so forth. And we have scaled that across several customers as well.
Yeah, one thing that I've become aware of, Eric, and certainly in the last few years with increasing frequency, is the release of new devices or upgraded devices to be used in the home. Could you describe some of those devices? Are they Wi-Fi based? Are they SIM based? Are they FDA approved? And, what's the story on those?
Well, that is always a complexity in this market, and assuring that these devices first are clinically accurate is the responsibility of the manufacturer of those devices. So it's very important that those devices where clinical decisions are being made from are FDA approved. Vivify has some responsibility as well with that to report when those devices are not operating as you might expect with the FDA. And we carefully select the appropriate devices to recommend to our customers. We can connect to virtually any device. And because of our size and history, we're approached constantly by new device manufacturers. There are some amazing devices on the horizon. Some, in fact, measure biometrics without a device at all. They use a simple camera, which we're excited about. We believe that will lower the cost of the technology and reduce some of the complexities. And we certainly look forward to accomplishing that with our device and AI and software partners that participate in all that we do. But these devices, there's much more than people realize in managing these, because they need to be A, purchased, B, inventoried. That's the small part of it. C, distributed, and then remotely managed, because there will be problems with technologies. And in the hands of a 90-year-old patient, if the tech isn't working, that's a lot of work. That's work that you do not want to give the nurses that should be managing only the care, not the technology. So part of Vivify's offering is the management of those devices, the direct support, and even remote controlling of some of those devices like the tablets to help assure that they're working seamlessly. That's part of our overall service. And then the logistics and distribution and negotiation with each of these device manufacturers that are constantly changing. It's a big part of what we do. You'll see a lot of new digital health shiny objects out there that will tout AI and some new devices. But if you look a little bit more closely, you'll see some of the limiting factors, such as a very short battery life or complexity for a senior population. These are things that we tend to avoid. We will show some occasional new glimmering objects, but we assure that they're highly scalable before we actually will deploy it within the platform. The goal is the best outcome and the simplest tech possible.
Well, and even some of these devices that seem simple and are simple, they don't always work like we hope them to, for various reasons. I give an example. My background's in pulmonary care, and pulse oximetry, where pretty simple. You stick your finger in a little clip or put a little clip on somebody's ear. Fantastic, gives you a great reading. But if you don't have good perfusion in those tissues, you're not going to get a good reading, or you may get a reading you can't believe at all. And so, that's a critical aspect. And as you say, those devices must be managed, and somebody's got to take care of that. We used to call it the last mile. It's like the last inch now, I guess, with these devices.
You got it. And Jim, that's a really good example of how technology can be applied beyond the devices themselves. So using a phone or tablet experience, when we recognize that the data is not coming across properly, we can provide videos and education materials on show them how to use the device properly, or for the example you gave, how to warm their hands up as an example to assure that they've got the proper blood flow going through, and how to remain steady. All those things can be accomplished with a very simple user interface, even to a senior population, so that they can get the best outcomes without the additional tech support and hopefully no support by the nurses needed for the technology.
Absolutely. Eric, unbelievably, we're almost totally out of time here. I can't believe how it's just gone by. But before we sign off to our listeners, tell us how we can find out more about Vivify Health for those individuals who want some more information.
Well, thank you for calling that out. And as I think most know, you can certainly find us at our website at vivifyhealth.com. That's spelled VIVIFY health.com. And Twitter at Vivify Health, Facebook at Vivify Health as well. And then you could even go to a page on our website, vivifyhealth.com/radio, where obviously, Jim, they can find out more about you and your podcast. And we certainly appreciate your help and guidance in the industry, and including Vivify into your vision.
To our listeners, thanks for joining me on this episode today of the Tate Chronicles. I offer a special salute to my guest today, Eric Rock of Vivify Health. Eric, thanks for coming aboard today.
Thank you, Jim.
I enjoyed it very much. Thanks so much.
I did as well.
Tate Chronicles transmission ending now.